Okay, so that means you are telling that the carotid sinus is related to cardiovascular system, regulation of blood pressure. Yes, this is actually the rapid acting or short term mechanism of blood pressure regulation is related to what? Related to our carotid sinus. Okay, fine. We'll talk about the mechanism and the carotid body. What is the function of carotid body? It is actually related to carotid body. It is actually related to chemical regulation of what? Both chemoreceptors. It is the chemoreceptor for both respiration and blood pressure regulation. So carotid body is related to regulate our respiratory physiology, yes, ventilation, and also our blood pressure regulation, yes. Both are regulated by carotid body, but carotid body is mainly or predominantly regulates our respiration, ventilation. Okay, let's discuss about the carotid sinus first and then carotid body and then its clinical. Okay, fine. So look, this is taken from Ganong physiology. The baroreceptor are a stretch receptor in the wall of the heart and blood vessels. The carotid sinus and aortic arch receptors. Okay, fine. So the receptors in low pressure part circulation are referred to collectively as the cardiopulmonary receptors. Okay, cardiopulmonary receptors. Cardiopulmonary receptors. Look here, related to CVS and also respiratory physiology is our carotid sinus. Okay, fine. So this is carotid sinus and it is nothing but the dilatation of internal carotid artery and the wall of the carotid sinus, and the wall of the carotid sinus some stretch sensitive receptor or mechanoreceptors are located. These receptors are sensitive to change in pressure. They are called the baroreceptor or mechanoreceptor, which are sensitive to stretch or pressure. Okay, then where they are located? They are located in the tunica adventitia layer of this carotid sinus. Okay, what is tunica adventitia layer? Look, this is the schematic representation of artery, cross section of artery. This the outermost tunica adventitia, then below it tunica media, and below tunica intima. At this tunica adventitia layer of this arterial wall, our baroreceptor are located. So baroreceptor are located in tunica adventitia layer of carotid sinus, yes, and they are sensitive to stretch, yes. When blood pressure is increased, then increased blood pressure stretch the wall of the blood vessels. It causes the stretching of the blood vessels wall, and this distension of the internal carotid artery or carotid sinus is sensed by our baroreceptors, those who are located on the tunica adventitia layer of this carotid sinus. And then this stretch receptor or this change in blood pressure sensed by our stretch receptors. Okay, then this information is carried by some nerves, which are called our carotid sinus nerve of Herring's. Okay, this is called carotid sinus nerve of Herring's, and from this wall of the carotid sinus they carried to the ninth cranial nerve in case of carotid sinus. Okay, fine. And this is called the sinus nerve of Herring's. Okay, so change in blood pressure, this information is carried by the sinus nerve of Herring's to the ninth cranial nerve, and then from the ninth cranial nerve to central nervous system, and then it regulates the blood pressure. How? Look here, Look at this diagram. What is this? This is also taken from Canon Physiology. So this is nothing but a representative schematic diagram of blood pressure regulation by carotid sinus. So carotid sinus as well as the aortic sinus, okay, both regulates our blood pressure. Now look here, this is the medulla and this is the nucleus tractus solitarius, NTS, N for nucleus, T for tractus, L for solitarius, nucleus tractus solitarius, NTS. NTS is located where? Located in the medulla of the brain, medulla oblongata. Okay, NTS, nucleus tractus solitarius. And then the at the medullary level there is another region which is called CVLM. What is CVLM? So first of all, this is medulla and this is our spinal cord. Okay, now what is CVLM? CVLM, C for caudal, V for ventro, L for lateral, M for medulla. CVLM is also called caudal ventrolateral medulla. Okay, fine. And then what is RVLM? RVLM is nothing but a rostral ventrolateral medulla. Okay, fine. So in our medulla oblongata there is various location, various region. They all are involved in our blood pressure regulation. How? Look here. So first of all, what? The CVLM. Okay. Neurons arising from the CVLM or caudal ventrolateral medulla relays at the level of rostral ventrolateral medulla, RVLM. R for rostral, V for ventro, L for lateral, M for medulla. So neurons which are originating from the CVLM or caudal ventrolateral medulla are activates. Generally they are not activating, they are actually inhibiting. Okay, then let's start from RVLM. What is RVLM? RVLM is rostroventrolateral medulla. Rostroventrolateral medulla. This is tonically active center. Which one? RVLM. RVLM is what? RVLM is tonically active center. What do you mean by tonically active center? Tonically active